achieve glass skin, what all of us see online, right? But as I came with that expectation, the whole conversation changed.
Korean skincare is all about layering, right? It's great for Korean people, not for someone who is from India. People don't understand the importance of sunscreen application. We have these multiple YouTubers claiming that Indian skin doesn't need sunscreen. Have a good sleep cycle, manage your stress. A lot of skin conditions such as acne, psoriasis, they are all triggered by stress.
Hey guys, I'm Ashu Jeffrey. Welcome back to the Healing Space podcast. So, before we begin our main bits for today, I'd just like to acknowledge something really quickly. So, if you have been following us till now, you'll notice most of our episodes were covered online since most of our guests are from different parts of the world. But today is obviously a very different scenario because, as you can see, this is our first one on one episode. And I'd just like to acknowledge this very major milestone for us and thank God for helping us reach this level. And most especially, our wonderful guest for today, Dr. Pragya, for first of all stopping the work at her clinic to be able to make sure this conversation is as smooth as possible, and also for accepting our invitation at all. It means very much to me. So thank you very much.
I'm glad to be here. So, I've known you for a very long time and I'm so happy that you've come up with this podcast.
Thank you very much.
Mhm.
So can you just tell us a bit about yourself?
So, my name is Dr. Pragya Punj. I'm practicing currently in Gurgaon. I have done my MBBS and MD from Nepal, BP Koirala Institute of Health Science. After that, I worked as a senior SR, senior resident in Deen Dayal Upadhyay Hospital, which is one of the biggest tertiary care center in Delhi. After
Nice.
that, yeah, and after that, after I got married, I moved to Gurgaon. I started my own practice. I have worked in few hospitals here, like Meteor Hospital. I have worked in past. I have worked in Marengo Asia Hospital, in Apollo Clinics. Now, currently, I'm just practicing solo at Derma Bliss Clinic, which is located in RD City, Gurgaon.
Very wonderful. Thank you so much for that. Okay, so let's get clinical. This episode was triggered by a very wonderful conversation between the both of us. So, some months back, I actually came here
Right.
with the hope of getting some Korean skincare products which will help me achieve glass skin, what all of us see online, right? But as I came with that expectation, the whole conversation changed, and I actually left with a lecture where you gave me a host of reasons why Korean skincare or any skincare literally won't necessarily give me the same results I see online. And I'll just love if you could share some of those reasons today with us.
Yeah, so Korean skincare is great. I mean, Korean skincare is all about layering, right? And it's great, but it's great for Korean people, not for someone who is from India or not for someone who is from Africa. I mean, we have to understand that they have a different climate, they have different genetics. So, the skincare which they promote is going to suit their skin type.
True.
It's not going to work for us if we have a very hot and humid temperature and you go on layering on your skin with different skincare products. It's going to result in more occlusion, more acne breakouts. So I see this on a daily basis actually in my clinic. People, they will bring a bag full of Korean products and they're like, how can we achieve this glass skin? I think this obsession is itself wrong. What we should be aspiring for is healthy skin. Like, how can we have a great skin barrier? How can we nourish our skin? It doesn't need to be that Korean skincare 10-step skincare routine. It can be as simple as just using a face wash morning and evening, follow it up with a moisturizer and a sunscreen in daytime. If you are above 25 years of age and you don't have a very sensitive skin, you can add retinol to your night skincare routine. In daytime, you can add vitamin C. That's it. I mean, if you do this consistently, it will give you a better skin rather than adding 10 different products. So yes, if you want the Korean skin product to work for you, or and I'm not saying that all Korean skincare products are bad. You can take one or two items from them which will be great for your skin. Like, I advise Cosrx snail mucin to certain of my patients. It's a great product. It has good anti-inflammatory properties. So my point is, don't fall for the thing you see on Instagram. Okay, visit your dermat, get your skin analyzed. If you have any active skin condition, try to sort them out. Don't be obsessed with the term glass skin because
True.
it's not achievable. I mean, there's nothing as glass skin. It's
Yeah,
more of their genetics.
yeah, exactly. Like it's more of understanding what your
Exactly.
skin is
Yeah.
and what your skin actually needs to be
Yes.
healthier rather than
Yes.
just
True.
because it's true. Some people chase the whole. I myself am a victim
Yes.
of that. I chase the whole glass skin thing as if
Yes.
in some sort of trophy. But
I mean,
as I go on,
having
I
a
tend to.
good, healthy, lively skin
Hmm.
is much, much better than going for glass skin, is what I would say.
Perfect. Why exactly do you think Korean skincare has so much influence around the world?
There are multiple reasons behind it. I think in recent years, have you seen how popular Korean TV series are?
Yeah, exactly.
So, you know,
Dramas.
yeah. So, what you see, you want. It's like that. So, once you start seeing such beautiful skin, you think that we also want that. And then we don't appreciate what we have actually.
True.
So, it's more of a cultural influence, I think, in recent years. Korea has developed as a good soft power right now,
That's true.
either with music, BTS, either with skincare or with TV series. We should appreciate it, but we should not aspire for that. Rather, we should aspire for,
Works best
yeah,
for
for
us.
our skin.
Perfect. I love that. And talking about the whole Korean skincare influence, what are some of the major misconceptions? Because you run your own clinic here yourself. What are some of the major misconceptions you see people bring to your clinic about Korean skincare and skincare in general?
So, I will not talk about Korean specific misunderstanding that people have regarding skincare. I'll talk in general. So, the most important thing I think is people don't understand the importance of sunscreen application. You know, we have these multiple YouTubers claiming that Indian skin doesn't need sunscreen, but sunscreen is very, very important. If you are not wanting any pigmentation happening on your skin, if you want to stay away from skin cancers, avoid tanning, then sunscreen is important. So, people have this misconception that we don't go out in sun that much, we don't need sunscreen, but even if for a minute you're out, the damage is done. So it's very important to apply sunscreen. Another misconception which I see happening very commonly, every day I get a patient who says my skin is oily, so I don't apply moisturizer. Now they don't understand that even oily skin needs moisturizer. You just have to select the right moisturizer. I mean, it has to be gel based or water based, because if you don't moisturize your skin is going to produce more oil, thinking that it is lacking moisture.
I see.
Okay, so these are some few misconceptions I see. And another is that I want skincare which is chemical free, which is
Paraben free.
natural. Yeah. And paraben again, they have this thing that it should be sulfate free. No, they don't understand. If your shampoo will not have sulfate, it's not going to create that
The
yeah,
bubbles.
surfactant effect
Yeah.
for your scalp to be clear. So it's not necessary that all the chemicals are bad. Okay, even water is a chemical, H2O,
Yeah,
right?
exactly.
Yeah, so this is, I think, a big marketing trend by certain, I'll not name the brand, that they are very clean and very chemical free. I don't believe in that. It's all bullshit, if you ask me.
True. Paraben free. I always see that and I always
Yeah, yeah,
wonder.
yeah. It's like now new thing I'm seeing is like we are free from all chemicals.
Yeah.
I mean, and
Natural, organic
yeah,
stuff like
natural
that.
organic. What
Eco-friendly.
is natural organic? Anything which is natural organic is also chemical. The thing is, you have to know what is the concentration of your product, the quality of the product, from where it is achieved. There should be better testing, like actually what they're claiming is true or not. So these testing they lack in India. They don't have strict regulations. Anyone can make a product and then just launch it in the market. So there is no good R&D departments. So that is, I think, where we are lacking.
Yeah. That's is something I know. I know many people who do that, but yeah, I hope
Right.
this helps them
Yeah.
understand things better.
Yeah.
And talking about this, let's analyze something. For these people who tend to see some of these products online and see some of the benefits, like this one heals acne, this hyperpigmentation, this for cleaning, unclogging your pores and stuff like that. When they see these products, they tend to go on into the market and get them without necessarily coming to see a dermat for clinical advice. So how risky is it for someone to get products or procedures without necessarily visiting the dermat?
Yeah. So we always think that if we have some major skin disease, like clinical disease, then only we can visit dermat. Okay, it's not like that. You can just visit a doctor or a dermat for your skin assessment also. Okay, rather than just seeing one product which is promising 100 things and buying it and then experimenting on your skin and then having some allergic reaction and then visiting a dermat. Visit a dermat first, let her examine your skin, let her suggest a good skincare routine for you. If you have any major issue like acne or pigmentation, take proper treatment for it. Don't hurry, be consistent with treatment. So this is more important than buying 1,000 products and wasting your money. We think doctors are only if you have some skin problem, but it's not like that. Even if you have a normal skin and you don't know which products are correct for you, you can visit a dermat, like what is actually your skin needs, rather than you buying every product thinking your skin this will help with this. And because all the and also understanding one thing that is very very important, that if you have pigmentation, you cannot remove 100% pigmentation. Okay, you can improve it, you can make it better, but it's not necessary that whatever your skin problem will can completely disappear. I see a lot of new products which are being launched, they are with the promise of that this will make pigmentation go away in 2 weeks, it will make your acne disappear in 1 week. So it doesn't work like that. For a acne to be treated properly, it will require at least 3 months.
True.
So I think there should be strict guidelines for these ads, for these products who are making false promise, and then in a way I can say they are making the innocent people feel stupid after they
Yeah, true.
use these products.
Yeah, in pharmacy we call it magic remedies, something like that.
Yeah, there's no magic remedy in
Exactly.
skincare. There's nothing as magic. It takes time, and your skin, even after your acne goes away, your skin requires time to heal from the pigmentation which is left behind from acne. Up to a year also sometimes it may require. So don't hurry. That's the only point
Be
I would say.
consistent.
Yeah, be consistent. Visit your dermat regularly when they say. It's not like once you have visited for an acne and then doctor has called you after a month and you're like, I didn't see so much of results, I'm not going to visit her back. No, come back to the doctor. Tell her how your experience was with the skincare, how much of improvement you have felt, so that the doctor can also analyze which product is working for you, what is not working. She can do a addition of another product. She can suggest some therapy for it. So it's a both-sided effort.
Yes, for this, some people don't even waste their time going online to find products, because I was discussing with some of my classmates back in school while planning for this episode, and they were like, in some parts of India, maybe some people use curd and turmeric together. Some people use some type of mud. I don't know. Like there are
Yeah.
different skincare let me not say skincare remedies, but there are different things people do to their skin, which I don't know if it works for them, because if they do it, maybe it does work. But I don't understand maybe why they do so when there's a dermat there who understands stuff like that.
Because again, they have this mindset that whatever dermat will give is medicine, and they have apprehension of using certain products. They think it's chemical loaded, and they prefer more these homemade products. I always tell my patient, eat your curd. The turmeric you are applying on your face, mix in milk and have that milk,
Hmm.
rather than like eat fruits, eat green leafy vegetables, have a good diet, okay, rather than applying them on your face, because they're not going to penetrate your skin.
True.
That is the most important thing. When a product is made and its composition is like if it has retinol, then that retinol is made in certain way that it can penetrate your skin. If you apply carrot on your face, you're not going to get beta carotene from it or retinol, but rather if you eat it, maybe you can get it.
Yeah, but at least in a small dose rather than what you
Yes,
originally get from in a drug and stuff like that.
yes,
Okay, so let's zoom in on India a bit more.
yes.
What are some of like the most common things you get to see on your clinic on a daily basis?
One of the most common things I get in my clinic is acne. Mm, every teenager has suffered, or even now, there's something called as adult onset acne, which even females in their late 20s and in early 30s are also getting. So, acne, I see on a daily basis, I get patients of acne. And another would be pigmentation, since we
I've
are a
noticed that
very,
myself.
yeah, there's a lot of tanning happening in India because I mean, it's a very hot country.
True.
So definitely we have melanin in our skin which protects us against the sun. So a lot of tanning. These are the common things, melasma and a lot of fungal infection.
Okay.
Yeah, because of so much of sweating, and also because of people, they don't take care of it. They will go to a nearby pharmacy, buy a steroid based cream, apply that. Now it will subside the disease for some days. Again, it will flare up. So it will be an ongoing process.
And for these things, or for solving any skincare procedure in general, do you think products or treatments like procedures are better when it comes to like improving skincare quality?
It's a combination of both. You cannot say that a patient, you'll do salicylic peel and he will not do any skincare at home, is going to get rid of acne. But definitely, if he is doing a proper skincare routine and you combine it with salicylic acid peel in clinic, then he will get better results. There will be less pigmentation, there will be less number of acne coming in subsequent weeks. So it has to be a combination. It can never be alone. Like for a melasma patient, even if I'm doing a very strong peel like Cosmelan peel, but the patient refuses to apply sunscreen, it's a waste of money. So you have to do your proper skincare, and with that, the skin treatments have to complement them.
Okay. So you mentioned something about like salicylic acid
Yes.
peel. What does that do to the body itself?
There are different kinds of procedures we do. If I have to explain about salicylic acid peel, someone who has a lot of active inflammatory acne, we do salicylic peel for such patients. We usually, it is used in concentration something between 20 to 30%. So what this will do is it will regulate the oil production from the skin. If there is any active acne happening on your face at that time, it's going to settle it immediately. And
It's for like intense acne treatment.
not for intense. Salicylic peel can also be done for someone who has a lot of comedones on his face, like
Black
blackheads.
spots.
Yeah. So it is a very mild, gentle peel which can be done. So peel, there is a range. Like there is something called a superficial peel in which your salicylic acid falls. Then there's something called as medium depth peel in which you have normalan phenol peels. You have higher concentration of peel in which your skin exfoliates basically. Okay, and then there's something deep peel which are not usually used in Indian skin type because there's high chances of having a post-inflammatory pigmentation.
Okay. Perfect. I love that. Okay. So apart from some of these treatments, products, procedures, whatever, what are some of the very practical and simple things someone can do on a daily basis to achieve a better, healthier skin?
Have a good sleep cycle, sleep 8 hours, don't be a lot on your phone, like limit your screen time.
For these simple things, you mentioned in the room last time, sleep, diet, you've talked
Yes.
about phone now. You mentioned like a lot of
Yeah, so
practical stuff.
you can do very simple things. Like first thing is I would say eat healthy, eat clean. Okay, eat your vegetables.
Your food is your
Yeah,
skincare.
yeah. What you eat is shows on your skin.
Sure.
So eat healthy. Okay. Second thing is have a good sleep cycle. Manage your stress. If you have a lot of stress, it is going to trigger skin conditions. A lot of skin conditions such as acne, psoriasis, they are all triggered by stress. So your stress needs to be managed, especially in this very fast lifestyle. We need to manage our stress. Another thing is having a simple, consistent skincare routine. Okay, and visit your dermat. I advise everyone at least once, when you start to think about your skincare seriously, visit a dermat. I'm not saying that you need to keep visiting it or you need to have any skincare problem only to visit her. Just visit, get your skin analyzed, and have a simple skincare routine.
Hmm.
So, and another important thing I would say is limit your screen time because
How exactly does screen time influence your skincare?
yeah, because screen time also produces blue light, right? And that also affects your quality of skin. So, someone who is on the laptop for very long hours is going to get damage, which is similar you get with sun
Hmm.
exposure. Not that intensity, but definitely.
Okay, it happens progressively. Like
Yes,
the
yes,
small amounts
yes,
add up.
yes, yes.
Wow. So even with the phone, it's risky.
Yeah, it's not risky. I'm saying just limit it. Okay, like do it in moderation.
I see. Okay, then to end it up, what are some of the ways anyone can create a better relationship with their skin rather than always trying to fix it? Because the main topic here isn't just about skincare or this or that. It's the fact that people are always trying to fix something rather than just maybe accepting what they are for what it is and working progressively on that.
One of the very common things I observe in my clinic is when a patient comes in, um, she will have 100 issues. Some of the patients, when they'll come, they'll say they have open pores, they have acne, they have a pigmentation happening to their face, they want to get rid of the freckles, they want to get rid at the same time of their double chin. Like, it's not possible that a doctor can fix so many things at the same time. And I just feel, and when I look at those patients, they are absolutely beautiful. I'm not saying, but someone in their family, someone in their surrounding told
Or
them,
maybe something they're seeing
yes,
online.
online, makes them insecure about their skin. So the first thing I do in my counseling is I tell them that you look absolutely beautiful, what it is. But let's address what is making you not feel good about yourself actually. Like what, and I always tell them, don't try to fix everything. Start with one or two things. So as a doctor also, it's a very big responsibility that you tell your patient that it's absolutely normal if they're having acne on their face. Okay, if they come with a family member who is telling like, doctor, she's having so much of acne, how is it going to, you have to tell that family member also that it's okay, we'll work on it. But
No pressure.
yeah, no pressure. On your patient, the more pressure they have, you have to first calm down that pressure rather than giving them a list of medicine. So that is very, very important. Counseling is the most important part you can do as a dermat, telling your patient that whatever the skincare problem they are facing can be cured with right medication. It requires time, and telling them to first accept that yes, this is there. Now they're looking out for a problem solution. So I mean, not overwhelm them more. I have had patients who tell me that they went to a certain doctor, and after visiting, they were more in a panic mode just because the doctor said this, we have to do this procedure for this, and like a lot of medications were given, they were not able to follow through. So, like, you have to build up that confidence in the patient first.
So apart from like the confidence and accepting what you already do, what else do you think someone can do to build a healthier relationship with their skin?
I think cutting out those people from your life first who always have a comment about your skin, your appearance, like just don't listen to what people have to say.
Remove the
Yeah,
external
remove,
pressure.
it's a very bad kind of toxicity which is happening a lot, I see.
Okay, so I personally and a host of my friends or people who come to India for various reasons, school, healthcare, and stuff. When we come here, there are a lot of new things we tend to experience, maybe because of the climate or the economy, pollution, stuff like that. Maybe acne, some sort of breakout, pigmentation. What do you advise for foreigners coming into India?
Okay, so whenever there is a change of environment, there is a high chances of your skin reacting to it. Okay, so it can be in a form of acne breakout or having allergic reactions to the sweat,
True.
because India is a very hot country. Okay, so in that condition, you should take help of your friends and do a good Google search, find a very good dermat nearby you and visit them. This is a very, very, I think, important step rather than going to any pharmacy in India, because Indian pharmacies are like, they will,
You tend to
they
market
can,
the
they
most
can
expensive products.
yes,
Same thing
and
happened with me when I
it
came.
happened.
Yeah, like when I came, I had a host of complications on my
Right, I
skin. This
remember.
before I got to know
Yes,
about your
yes.
clinic. So I went to a certain pharmacy I don't want to disclose, and I think what they did was they just sold me their most expensive products rather than actually giving me what I needed for my skin and stuff
Right.
like that. And even after taking those products, the situation became worse. And a host of my African bodies complained about the same thing when they came.
They
And
feel
it
scammed.
exactly, it's still like came to your clinic and I literally had to trash out all those products I got,
Yes.
then got
I
new ones and started working on them consistently.
Yes, because sorry to say, but people in pharmacy, they don't know, they cannot analyze your skin. They can provide you with the product if you tell them, I need this or that. Okay, so for someone who is experiencing an allergic reaction, it's very important that you do a thorough Google search. Look out for a dermat, or you can ask your own colleagues who are studying with you to suggest you a good dermat. Visit the doctor. They, it's not like they can only analyze Indian skin. Even if you're an African patient, they can analyze your skin, they can tell you products which are correct for Indian skin, for the Indian weather.
Okay.
So yeah, I would suggest visit a dermat. Don't be fooling around in these pharmacies.
True. Makes so much sense. And thank you so much for that. With that, we have come to the end of this very wonderful episode. And I just want to say a big thank you to you again, first of all, for accepting us here, accepting to feature on the platform, and for the wonderful work you do here at Derma Bliss. I can remember when you were at your former clinic to when you moved into this new, even more wonderful
We
space.
are moving into a bigger space.
Soon, okay, you're going to a
Yes,
bigger space again.
yes, yes.
So like every time I come here, I notice the place is always packed, and I know people aren't just coming here because they lack other places to go to, but because of the quality of the treatment you give them here at Derma Bliss.
I really
So
appreciate those words.
I very much encourage all of you guys, especially those who are in India, to please come to Derma Bliss for understanding your skin, for better skincare knowledge, and for even your workers. The customer care here is impeccable. I'm so happy
Thank you
for
so
you
much for those
guys.
lovely words.
And I pray and hope you guys continue to do better and better work and get even more recognition from the public.
Thank you.
For nothing. Thank you too.